Hi there, and welcome. My name is Daniel Rasmussen, and I'm the founder of Pinnacle Integrative Health and Echelon Center Longevity. I'm a nationally board certified diplomate of Oriental medicine and integrative medicine specialist, function medicine specialist. But more importantly, I'm someone who believes you deserve more than just managing pain until it's bad enough for surgery. All decisions to participate in a consultation and or receive any type of medical treatment are between the patient and his or her healthcare provider after discussing all benefits and risks of any treatment. Okay, let me guess. You've been told it is just arthritis. Try some NSAIDs or non-steroidal anti-inflammatory drugs, or let's do a cortisone shot. Or the worst, we'll replace the joint when it gets bad enough. Until then, you're just going to have to suffer. Sound familiar? Well, this reactive system was never built to heal you. It's built to manage symptoms using drugs, injections, and eventually surgery after things get worse. Here we see a study done, Medscape Medical News, wording on steroid injections that they basically cause more harm than good. And they actually degrade and erode the cartilage in the joint and weaken tendons and ligaments and rotator cuffs and discs in your back. So whenever you get a cortisone injection, you are weakening and degenerating that connective tissue 3 to 5 times faster. Short-term relief, but in the long run, you're causing more harm to your body. I don't know why we still use this as a treatment. It's outdated. It's archaic, and it's time to move and evolve to the next level of care. Here's what insurance covers. FDA, Medicare, and all insurances statewide cover 4 options: pain meds, cortisone injections, physical therapy, and surgery. That's it. No prevention, no regeneration, and no healing. At Pinnacle, we do things differently. We combine modern science with holistic wisdom to treat the root causes, not just symptoms. So this is our team here. On the left is Jared, then me, then below myself is Maria, and then we have Oliver and Tam. Since 2010, our clinic has been recognized and award-winning, voted top integrative medicine, Washington State, recognized by USA Today for leadership and regenerative innovation. And we spent over 15 years refining a proprietary method that works amazing. Let's walk you through our latest version of the GPF method, now enhanced breakthroughs for even better outcomes. So we got phase 1, which was preparing the tissue for stem cells. And the prepare phase is broken down into 5 steps. Step 1 is we do peptide therapy.
Step 2, you will receive alpha-2 macroglobulin, and we'll talk more about this in a moment. Step 3, we introduce class 4 cold laser therapy, photobiomodulation.
Step 4, we do platelet-rich plasma, or PRP. Step 5 is prolozone, or ozone therapy. On each of these visits, we do lymphatic drainage therapy throughout fall visits in order to stimulate the release and clearance out of the body of all the inflammation and toxins that are causing the degeneration. Next, we have phase 2, which is repair phase. This phase is broken down into 2 steps: the Wharton's jelly, cellular stem cell injection, and then finally, physical therapy for stabilization and strengthening of your joint, your spine, or your core. What makes us different is before your first injection, we apply a series of exclusive iontophoresis patches, topical patches. It's just a needle-free way of delivering a cutting-edge peptide stack into your system. NAD plus charges your mitochondria, which is powering the tissue repair. It's getting a systemic signal to your whole body to get ready to say, hey, we're going to go into healing mode here, regeneration mode. Stacked that with BPC 157, which promotes soft tissue and connective tissue and nerve healing. And then GHK copper, which is a signal to boost collagen, skin, and vascular regeneration, because all of those tissues are critical in the healing of your body. This stack primes your biology to respond faster to the regenerative treatments. And no other clinic we know of is using this proprietary delivery system. Step 1, A2M, alpha-2 macroglobulin, which is a new breakthrough treatment to stop degeneration in its tracks. It's a naturally occurring protein filtered from your own blood. It traps and removes inflammatory proteases. These are little enzymes that act like Pac-Man, chewing away your cartilage. By removing these culprits first, we stop the damage in its tracks. Number 2, both the healing between the visits. While at home therapy tools, as seen in GQ, Men's Health, Good Housekeeping, Elle magazines. We equip you with a clinical grade home therapy device for use between the treatments. This tool delivers fantastic results using advanced class 4 cold laser photobiomodulation therapy, as well as a rolling tool to roll out that inflammation to use it. So red and infrared therapy provides gentle, targeted cellular stimulation. And what does that mean? It helps your cells make more ATP, which is the energy molecule inside your cells. It reduces inflammation. It accelerates tissue repair from the comfort of home. So this is one of the most advanced photobiomodulation therapies on the market. Next, we've got platelet-rich plasma, which uses your own blood spun down to concentrate growth factors. This is injected into areas of damaged tissue to signal your body to start the healing process naturally. We draw blood, we separate it by spinning it at a high rate of speed, and this reduces muscle pain and inflammation, muscle weakness. It starts to strengthen weak ligaments and tendons and inflamed nerves. Very, very effective. Next step is we inject ozone gas into the joint or the surrounding soft tissue wherever it's needed. We don't hold back. Ozone rapidly converts into oxygen, and oxygen is the critical component for cellular and healing repair. Think of it like injecting fresh air into a suffocating room. Prolozone reduces inflammation, relieves pain, and sets the stage for regeneration. You don't build a house on top of a cracked foundation. You want a rock-solid foundation to build upon. Once the site is cleared, oxygenated, and primed, we inject the Works Jelly, an ultra-rich biologic derived from healthy, ethically donated umbilical cord tissue. It contains young, vibrant stem cells in a very high concentration compared to your own stem cells from bone marrow. It also contains growth factors, exosomes, and cytokines, along with hyaluronic acid. These cells migrate toward injury, release regenerative signals, and help your body rebuild cartilage, tendon, and ligament tissue, not just patch it. They're safe, immune neutral, and non-surgical. Your immune system will not reject these stem cells because they have no antigens on them. So your immune system doesn't even recognize them as a foreign body. So a little bit about bone marrow stem cells. This is a study that was done. If you look on the left column there, that's how many stem cells a newborn has. That's how many you had when you were a child. This is why you heal faster when you're younger. And as you grow older into your teens and 30s and 50s, and by the time you're 80, you only have 1 in 2 million bone marrow cells will be a stem cell. So you've got nothing left by the time really you're past age 30. There's nothing left meaningful. And it really is not an ethical treatment to use. You're past that age. It's not going to work. So stem cells are attracted to inflammation. Our tissues release these little SOS signals when in deterioration and pain. These SOS signals attract stem cells, which then release specific tissue growth factors where they're needed. The signaling is critical for healing and regeneration. And that's why you're not healing after the age of 30, is because your stem cells have been all depleted. It's time to put new stem cells in those tissues. Now, most people don't even know how their lymphatic system functions, but it's your body's sewage system responsible for flushing out inflammation, toxins, and metabolic waste. And here's the thing. Unlike your heart, the lymphatic system has no pump. So when it's stagnant, healing stalls. Flowpresso is like a spa-grade reboot for your detox system. Think of it like a rhythmic massage suit that compresses, detoxifies, and calms the nervous system all at once. It combines compression, infrared, emotional de-stress in one relaxing 30-minute session. It flushes inflammation, boosts circulation, and clears space for your body to heal. Healing without lymphatic drainage is like renovating your home without taking out the trash. Flowpresso takes out the trash and makes you feel lighter, calmer, and clearer. Next, we have physical therapy, which begins approximately 4 weeks after the GPF method. Physical therapy is another step in the neuromuscular re-education process to restore and stabilize normal, healthy joint function. It's a critical part of this process. Next, we're going to go over what an anti-inflammatory versus inflammatory food and diet looks like. You will receive training, support, guidance, and nutrition for healing energy and anti-inflammation to look your best, to feel your best, and perform your best. Most of our patients follow our process of getting back to real healthy foods, no packaged processed foods, and they're feeling better, more energy, they're sleeping better, they're losing weight, and they're keeping it off for good. Now let's take a look at the option of surgery. Not many people are aware of this, but knee or shoulder surgery is not a guaranteed fix. It's about a 50-50 satisfaction rate. There's 6 to 12 months of downtime, pain and suffering, risk of hardware complications, infections, or permanent limitations. There's about a $10,000 to $20,000 in out-of-pocket costs, even with insurance. So if you're going to spend $10,000 to $20,000 to have your insurance replace and do a surgery, once it's done, there's no going back. Why not try regenerative medicine first? Patients who go through the GPF method typically feel better within 8 to 12 weeks with continued regeneration process, continuing through 12 months. So this is that after that 12 months is finished, that's a long-term repair. We're not offering a Band-Aid treatment. We're offering real regeneration and long-term transformation. I can walk without pain. My shoulder finally moves. I avoided surgery completely. You can read dozens of our reviews on Google and see video testimonials on our YouTube channel. Just look up YouTube channel, Pinnacle Health. We've got over 60 reviews on our Google listing. So really, please look it up so that you're feeling confident about making a decision in due process. So what happens next? If you're tired of symptom chasing and you're ready for a better way, this is your moment. If you haven't booked your evaluation, book it. Discover if you're a candidate for the GPF method by completing your examination and evaluation.
Build a plan to get you pain-free, energized, and back to the life you love. Remember to bring your spouse or your partner as your support person in medical decision-making. Because if you are a candidate, you will be given recommendations on this visit that are personalized to your unique situation, designed to meet your goals, and medical decisions will need to be made with your spouse or partner present, because this is about your quality of life and it's important to have your team included. If you do not have a spouse or partner, we can help you find one. No, I'm just kidding. But all in all, we can't wait to meet you and support you on your journey back to full function and being pain-free. Oh, and one more thing regarding parking, just type in Optum Parking Garage in the Medical Dental Building, downtown Seattle. And from there, you can simply come straight up from the elevator in the parking garage to the 8th floor. Again, use Google to guide you in. Google the Optum Parking Garage in the Medical Dental Building to guide you into the valet parking garage. As an alternative, you could also take the light rail to the West Lake station, and we are on the street level of that station. If you have any difficulties, please don't hesitate to call and let us know if you need assistance. We're here to guide you in, much like an air traffic controller. We'll see you soon.